you mentioned testosterone implants for men. Do men go through menopause?
We don't go through menopause, but here's what's really interesting. For men especially, it happens so gradually. You know, women get hot flashes, they get night sweats, there are sudden symptoms, okay? Men were not like that. One, we don't like going to the doctor, we never want to admit anything's wrong, but two, it's happened so gradually that we just kind of fall into a funk and we just get used to it. And then we wake up one day and we're like, why don't I want to do anything anymore? So yeah, it's called andropause, but it's different. And so a lot of men don't even recognize what's happening, honestly, until their wives come in and get treated, and they say to their husbands, okay, what's going on here? You're not, you're not yourself anymore, because now I'm myself again, and I see that this is not how we used to be. And it's really interesting. That's the point that most men will come in and get treated.
How would you treat that?
As you know, there's a lot of commercial products that are available out there. You'll see the commercials, Androgel, Axiron, Fortesta. There's a lot of commercial products that are good, and we use those. Now, the thing they have in common is they're all transdermal, which means they're gel, we rub them on, okay? The difficulty with that can be, one, you have to do it every day. And, guys, we're not very detail-oriented sometimes, so getting that done every day can be a challenge. Two, not everybody absorbs things the same through their skin, all right? My finding has been that with the lower doses of these treatments, that most men's results are suboptimal. So they're not really gonna work that well. Like women, we also have the implant therapy that we can do for men. So basically the same premise. We're numbing up an area in the hip. We're putting the testosterone implants in the area underneath the skin. It heals up very quickly. The advantage of testosterone is it lasts quite a while, so we can commonly go 5.5 to 6 months with each treatment. And the great thing is we're always getting the levels up, not to what would be necessarily normal for our age, which really doesn't give us all the benefits of testosterone therapy, but optimal. So in other words, let's say you have high blood pressure and you come in and we're gonna control your blood pressure. Well, we wanna get it to what would be optimal, right? Okay, hormones are the same. We don't wanna treat your hormones just to get them maybe to the lowest level that would be okay for your age. We want them to be optimal, which is usually the levels around our mid to early 30s. So I think that's one of the things that we do here as well that's different. We're going to treat you regardless of whether you're a male or a female, and we're going to optimize those levels.
So Doc, if you could sum up your philosophy in one sentence, what would it be?
I think it would be the science behind a spectacular second half of your life.